Hey, everybody. Welcome to One Take Live. I'm Monica May, and as we know, or you may not know, September is Prostate Cancer Awareness Month. And as long as I was at a radio station here in town, we always did Tom Joyner's Take a Loved One to the Doctor Day. And from that, many men who never would have had one particular exam were able to be screened for free. And over the years, we've been able to save lives, and that's prostate cancer screenings. Okay, Prostate Cancer Awareness Month. This month, we've got Dr. Christopher Scott on with us this evening, and we've got a few things to talk about as we get ready for our big webinar that is September 23rd. And then we're going to do some screenings on the 26th. So, Dr. Scott, I want to say thank you for all the years of service that you gave us to Star 94.5 with Tom Joyner's Take a Loved One to the Doctor Day. Thank you, thank you, thank you.
Very welcome, very welcome. Thanks for having me on.
How are you doing, and what have you been doing since I last saw you, sir?
It's been a minute, huh? Well, I've been in school. I've been running several ERs on the west coast of Florida, trying to deal with and avoid COVID myself and help the community deal with COVID. So it's been a very busy half of the year.
You have been busy, and I do want to say thank you for bringing your lovely wife over to CB Bistro and giving us a chance to sit down and talk about what we've got ahead of us.
She can't wait to come back. Food is amazing for everybody watching. So
wow, thank you so much, so much. So when we talk about prostate cancer, let's first talk about some of the fears that especially African American men have with just the screening period.
Oh, absolutely. Well, first, I'd say the first and foremost fear is just that, it's going to hurt. They feel that there's going to be a violation of their personal space. There's this misnomer that it can't happen to me. And of course, all the, just associations that go along with it. But it's one of the few cancers that early detection is the key and can almost guarantee survival rate past the 5-year mark. So, I mean, it's critically important.
Mm-hmm. And when we talk about that, there is prostate, the PSA test, which is the blood work that has to be done with it. Now, this is 2020, and there seems to be a little bit of debate that you don't need both. You only need the blood antigen piece of it. That's the, get your blood drawn. And then if the numbers show high, then they say a man should present for the digital rectal exam. Is that true?
No, that's absolutely false. So first of all, the cutoffs, which are around 2.5, those are levels that we look at to make some determinations, are lowered for certain populations of what you're going to consider high risk, as well as they can be bumped for reasons other than prostate cancer, and you can have prostate cancer and they be low. So what physicians really look for
go ahead and have both of them done.
Is a change in the number from one value to another.
Chris, what I need you to do is go back some because we glitched out for just a moment.
All right.
Yeah. So we were asking whether we need both the DRE, the digital rectal exam, as well as the PSA, one or the other, or both.
You need both. You need both. And I'll tell you why. So first of all, a low number can still correlate to someone that has cancer. So, I was saying we use 2.5 as a general cutoff of do we need to keep looking at this or monitoring this more often? But someone that is at 1.2, for instance,
yes,
jumps to 1.7, that change in the number can indicate a problem, in which case they need to have what's called a digital rectal exam, a DRE. Okay. And it is the combination of those two things that leads to the increased suspicion and need to move further to biopsies and further imaging, things like that.
Mm-hmm. And when we get to our big webinar on September 23rd, we'll talk more about the biopsies because there's even fear about that. So we want to make sure to just kind of alleviate some of that. I mean, but by right, we've had tests done to us forever. And that's one of the things. But at what point do we stop blaming every syphilis? That was a life of, it was horrible.
Yeah, absolutely, absolutely. You know, we suffer kind of from two things as people of color. One, we have the whole stigmata of testing that was inappropriately done on us, and then we have the combination of being a population at risk for not receiving the proper test that we need. You know, there are. Oh, she might have blanked out. Are you there, Monica?
Compared with their white counterparts. Why
Oh,
is it that we always struggle like that? Why is that?
okay. You blanked out for a minute. I'm going to assume your question was, why do we have disparities in healthcare?
Just no disparities in the numbers of how our men show up against white men. And we have the world's highest incidence of prostate cancer and a more than twofold higher mortality rate. Why is it that it always happens like that with us?
All right. So in specifically speaking of prostate cancer,
Mhm.
there are certain genetic components that go along with that. So there are actually legitimate biological reasons for a higher incidence. And when you're talking about mortality, that comes in combination of our own fears of testing, so our apprehension to go and get screened because it's early screening that leads to early detection when
For the
treatment
better.
can be started.
Mhm.
So that's our inherent problem, combined with again disparities in healthcare. So you have external contributors such as if you are in a society where people are testing you less or not explaining to you, for instance, for a normal low risk population, which would not be considered African American or people of Caribbean, our testing is supposed to start at 45.
Wow.
So if you're not educated on that and people are going with the normal 50-year-old start of testing, you're already 5 years behind the curve.
Yes, yes. So again, what Dr. Scott just said is that African American men should begin screening at the age of 45. Typically, we would wait until 50 to do that. A couple of things that we're going to talk about. We're going to stop for a quick commercial break to just publicize the webinar that we're getting ready to do. And when we come back, we're going to talk about why it's so imperative to be screened. It has to be something that is part of your physical regimen when you go to the doctor. And if there is no way for you to get a test, we have a way for you to do that. We'll be right back after this. Welcome back to One Take Live. I'm Monica May, a little bit hoarse, oh my goodness. And we have Dr. Christopher Scott with us this evening. He has been one of my go to Johnny on the spot whenever I need him doctors for me throughout the years when we were doing Take a Loved One to the Doctor Day. And Dr. Christopher Scott agreed to be with us tonight, as well as on the 23rd, that webinar that you can sign up for. We're going to give you more information about that. We also wanted to give you a couple of more pointers. There are some risk factors involved with prostate cancer. Is that not correct?
Yeah, absolutely, that's correct.
Being
So
Black, what else? What else would you say are risk factors?
yeah, so unfortunately, yes, being
You
Black
know,
is a risk factor. We tell it like it is. And now you associate that with obesity.
yeah.
You associate that with smoking.
Okay.
You associate that with an incident of sexually transmitted diseases or prostatitis. So basically, anything that causes your prostate to continuously swell and shrink, being exposed to inflammatory agents, we call them within the body, is going to make those persistent changes cause you to be susceptible to developing cancer. Even vasectomies, you know, a lot of people say, hey, we don't want kids. Having a vasectomy can slightly increase your risk. So there are definitely risk factors associated with it. You there, Monica? I know we we're on this virtual internet world now where things go back and forth. I don't think it's anything on my part. Oh, did I lose the whole connection? That was Monica? She must have lost her feed.
Mm-hmm.
All right, Monica may have lost your feed. That sucks. We were having a good conversation.
Mm-hmm. Technology, bro.
Yeah. I like the little embroidery though. Wish I had a green screen in the background though.
Mm-hmm.
Thank you for calling. You've reached the desk of Monica May in Star Cares.
Damn, she was on some good questions too.
Mm-hmm.
We were just about to hit some points. Come on, Monica. Hey, are you all still on? I think we dropped.
Well, I don't know what happened. Now, I tell you, we've done like almost 25 of these shows, and that has never happened.
Oh.
So what we're going to do,
Mhm.
Monique said what we're going to do is just start all over.
Okay.
And then, I mean,
What the hell? So give me like 5
Do-
minutes.
she said give her 5 minutes, and she's
Do I need to come out this studio
going to
or
send you a new link.
was she gonna send me a new link? Okay.
A new link, yes.
All right, I'm gonna close it.